What is up, guys? It is RealCarleRae. It is your nurse bae, RealCarleRae. I am back off of vacation and I missed you guys so much, so much. So if you guys do not know, there was a particular nurse that was working on the floor that ended up giving a wrong medication to a patient, and the patient ultimately died. This video is all about how to prevent med errors like that, so that you could save your life and save your patient's life as well. Without further ado, I'll get right into this video, guys. So alright, so I got back from vacation and I seen this little tabloid come across, and it was just really talking about how, I mean I got the news late, yes, I got the news late, but nonetheless it goes without saying. And if you have been under a rock, like I was up under a rock, I was planning a wedding, I was doing all this, but the article pretty much stated that a nurse gave a wrong med, and to quote it, the nurse ended up giving Vecuronium as opposed to Versed. So I'm gonna just pull up the article right now, and if you see me looking down, it's because I'm looking down at my phone, because I have the article pretty much pulled up here. So the incident happened in Tennessee. It was a nurse, and it was back in December 2017. So the patient was going to CAT scan. They were a little bit anxious and worried, and you know, some people do have claustrophobia, and so he was just pretty much experiencing that and anxiety and things of that such, and so the physician ordered for Versed to be given, but when the nurse went to the Pyxis, she typed in VE and she mistakenly pulled Vecuronium. I'm not sure if you guys know, but in the emergency room, you guys are already thinking like, no, like what? She pulled Vec and she gave it?
What? Oh my God!
Like, what the heck? But for those of you who do not know, I will enlighten you what Vecuronium is. So Vecuronium bromide, sold under the brand name, is a medication used as part of general anesthesia to provide skeletal muscle relaxation during surgery or mechanical ventilation. Pretty much, she paralyzed the patient. After she gave the medication, she sent the patient to the CAT scan, and the patient ultimately ended up passing away. Big no-nos. Big no-nos that she messed up was, A, she was probably going a little bit too fast. So to prevent that very fatal event from happening, I need you guys to slow it down and to type in the whole exact word of the medication. Don't just type in the 2 letters like the nurse did. I need you to type in the whole exact word and pull that exact medication. I need you to be aware of the medication that you're pulling. So for instance, for me, I would pull a medication and I would look at it every single time. I know I'm pulling it from the same drawer and it's popping out this one drawer, but you never know if the pharmacist feels the drawer wrong or anything like that. So I need you to be very observant and very diligent when it comes to administering medications. In the emergency room, I know that we're quick, get it done, quick, get it done. But you also got to understand that you have patients that rely on you, and ultimately their life lies in your hands. So I need you to pull the medication out and to really just look at the medication. For me, I always do that. Always. I will always read the bottle of the medication that I'm giving. Also, furthermore, I would even look at the packaging. If the packaging is even different, y'all, I'm like, wait a minute. We got some new? Okay. It says the same thing, same strength. Okay, cool. You know, so I need you to pay attention to that. I need you to pay attention to the label, how it looks, the milligram strength, because you never know, like when you get a new medication, you know, you say for instance, the doctor ordered Ativan, it popped out, the Pyxis pops out Ativan, but say it's 2 milligrams as opposed to the old school 1 milligram like you used to have. You get what I'm saying? So I need you to be wary of that. So always look at your medication vial and look at the dosaging and look at the color of the packaging, because that will sometimes change as well. I've had it happen a lot. And just type in the whole entire word of what you're needing to pull. So for 2, in the article, it also stated that the nurse overrode the Pyxis and still pulled out Vecuronium.
Oh, hell no!
Big red flag, big red flag. The Pyxis is there to try to help you eliminate those type of med errors. So the fact that you had to override it lets me know that, like, hey, A, you were either in a rush and you just was trying to pull a medication, or B, you probably just didn't know what you were doing. So in that instance, if it told you no, you need an override, don't just type in the override. Go to the charge nurse and ask, hey, what's up? Why do I need an override? Like, what's going on? What's happening? Also, the article stated that with Vecuronium, you need to reconstitute that. And when I say reconstitute it, that means that it comes in a powder substance. So you will need to put like sterile water with it before you actually administer it to the patient. So not only did she go to the Pyxis, just type in VE, she overrode the Pyxis, and then on top of that, she even had time to reconstitute it. And you know, sometimes with the swirling, it may take a little minute to reconstitute certain medications. But yeah, just knowing that she had to do all of that and then administer the medication, and she just sent the patient off. Like, you know, that just kind of, you know, scares me a little bit. If it were me, I honestly wouldn't have even just typed in VE. I always type in the whole drug name until it like narrows down, you know, my choices. I will always look inside my Pyxis and see the drawer that it pops out, the medication, and I always read it. I will always read it. If it told me a red flag or anything like that, I don't just press override or anything like that. I always take that second look. And with me, if my patient was going to CAT scan, which they were probably going away from me, so that means that I would have administered the medication and I would have went to CAT scan just to observe my patient and make sure everything was good. You get what I'm saying? Because everybody will react differently to a medication. So ultimately, you are responsible for that patient. So I wouldn't want you to just administer Versed, which if you guys do not know what Versed is, I'll tell you exactly what Versed is. So Versed, number 1, is a sedative. It can help patients feel relaxed or sleepy before surgery or medical procedures. So if I just gave you a sedative and I let you go freely, then that's on my behalf and I'm wrong for doing that. What's appropriate is for me to stay with you up until I feel secure that you're able to tolerate the side effects of said medication. So don't get me wrong, I feel so bad that this happened to her, but I kind of feel like maybe the nurse was a little bit overwhelmed, or maybe she was busy, or maybe her patient load itself was just too much for her to handle. So I mean, it's a lot of circumstances behind that situation. And, you know, and I'm not trying to bash her or anything like that, but at the end of the day, sweetheart, somebody lost their life. And, you know, that could have been your loved one, my loved one, anybody. And that was somebody's loved one. You get what I'm saying? So at the end of the day, us as nurses need to be very diligent and cautious about the medications that we're administering to our patients. I don't think you guys understand, when you become a nurse, you really hold these patients' lives in your hands. So you have to be very careful with the drugs that you administer to your patients. You have to know what they're used for, know why they're being used, and some side effects of those medications, you know, the route to use that medication. And don't get me wrong, I've made a med error myself. I've given Levsin IV as opposed to giving it PO, but it can be given IV as well as PO. But, you know, don't get me wrong, I fessed up to it. I told the physician that, hey, I gave Levsin IV, and he's like, it's okay, you know. But you just gotta understand that you need to be cautious whenever you're administering these medications. If you guys would like to look up the article, just go on Google and just type nurse gave wrong drug, and you will see the article. And I hate it that they ultimately ended up arresting her and charging her with manslaughter. So, and I don't want that to happen to you guys. So just please be careful. Please be careful and try not to let this happen to you. Don't let it happen. But that is all I got today, ladies and gentlemen. Sorry guys, my camera died, but I'm on my vlogging camera right now. But as I was saying before, that is all that I have for you guys, and I hope this was very insightful for you guys. And for you new nurses, I highly advise you to look at that article. I don't want you guys to feel like you're invincible. I'm on top of the world, I just graduated, because Jesus can very well humble you. Please go look at the article. Guys, just be careful. Please be careful. Like I said, I don't want this to happen to you guys. So but that is all that I got today, guys, and I hope you guys are doing well, living well. I'm living well. I'm happy, and I'm happily married now, and yeah, I'm back. So see you next time, babies. Bye.